Shikues të nderuar, mirëmbrëma edhe mirë se vini në debatet parlamentare 2014. Tash më lejoni të prezentoj panelistët shumë të nderuar që i kemi sot për me diskutu për energji dhe ambient si ekipe të çdo partije politike.
Për të realizuar furnizim të rregullt, të sigurt, cilësor, mjaftueshëm dhe të përballueshëm, do të ndërtohet termocentrale në bazë të linitit, Kosova C, me kapacitet instalues prej 2 herë 300 MW deri në vitin 2019. Dhe 600 MW të tjerë deri në vitin 2023.
Strategji sa dush, po pse su marru mo qaj? Termocentral. Pse su marru, zonja Zherka? Pse su marru?
Mirë, po 2100
Asme o, kë su marru pushtet, asme për të këmë pushtet.
Ajo që ka duhet të thuhet është që prej 2018 dhe 2022 ka me qenë terri mesjetar cilën e kanë pru me misionin e
Faleminderit.
The international community, especially USAID and the World Bank and the EU, they've been very much engaged in helping the Kosovo government introduce the first energy policies here. However, I mean, to my big surprise, I've seen that they wanted to cross all possible red lines in this aspect. They wanted to build 2100 megawatts, which goes much behind the, let me say, energy policies of European Union 2020. And that was a very bad idea. That was a scenario which me and a lot of the, I would say, other experts wanted to fight for, and we succeeded really to somehow raise the attention of the citizenry that if that appears, that comes as a future of the Kosovo energy system, then that will be disastrous.
My name is Visar Azemi. I currently am the coordinator of Kosovo Civil Society Consortium for Sustainable Development. COSID has been engaged in the debate of the energy sector because the energy sector remains a huge problem in Kosovo. Kosovo has 2 existing power plants, Kosovo A and Kosovo B. Both have exceeded their lifespan. The government decided to move on with another project to replace Kosovo A with a new power plant of 600 megawatt, which they call it Kosovo C. We see a lack of willingness from the government, from the agencies here to support renewable energy, but rather move on with the coal project. This whole debate is getting bigger and bigger and influencing a wider group of people in Kosovo and also other stakeholders who are engaged in the energy sector in Kosovo from the international community.
Well, in terms of environment, I think that working in KEC is actually very challenging because KEC is working with plants and with facilities which are very old. Actually, we are working with facilities which are at average at the age of 50 years or 35 years, and we have to cope with those facilities, which at the time what they have been built, the environmental concern and the pressure was not as high as right now.
I'm Abdul Mustafa from Planetina. I work on Roma NGO called press service. So we have some health issues, such as the issues with breathing, because we know that in our area air is not healthy. I really want to know the percent of our air pollution because the mostly problem that we have is it's the dust that comes from the power plant.
All of the studies were showing that the dust emission was the biggest problem at the area around Kosovo, which has been felt not only environment in municipality of Obelic and for Kosovo, but up to Pristina during a certain time of year you could see clouds of dust which were flying around from the ash dump which was produced at Kosovo.
In Pristina, in this moment, me and you, we are breathing, let me say, the integrated pollution of Kosovo A plus Kosovo B. The idea of being just next to existing thermal power station is the one which deteriorates situation a lot.
We have never been talking about the external cost of coal. We all know that we have huge reserves of coal, but we never kind of calculated what the coal does to the environment and the health of Kosovo people. 852 people died prematurely in 2010 because of pollution. More than 23,000 of new cases of respiratory disease in children, and so on. So more than 100 million euros have been spent seeking medical advice outside of Kosovo because of the respiratory diseases of people in Kosovo, living in Kosovo. So this gives us an idea of what we're talking about when we talk about pollution.
So my name is Dr. Gazmin Bjouli. I am a specialist pulmonologist and I'm working as a doctor since 1985. And now I'm director of the clinic of lung disease and also the executive director of Association of Pulmonologists of Kosovo. The impact of health pollution is really very, very, very big, and especially during the winter periods when we have more patients who are suffering from complications from respiratory disease. And epidemiologically, during the winter is more respiratory disease, which is normal. But the problem is that we have more pollution during the winter, and that we have doubled number of the patients than in other countries who don't have this kind of polluters. So we have more patients, we have people who are we have more complicated cases. Not only the elderly people, but also the more and more young people are suffering from respiratory disease. So this is what I am seeing every day, every year.
I'm going to try to have more cooperation with municipalities, because I know that if they want, they can help us. Before, nobody came to us and speak with us about these issues, about air pollution. You know, we also, yeah, it seems like that we live in this area that really, I don't know. It seems like problem. It's complicated.